Story about the second phase of the vaccination, which begins today, and let's talk about the different variants that have been detected in the country. And I'm talking about the corona variants detected in the UK, India, and South Africa, are now finding their way into the community, with the Ministry of Health cautioning Kenyans to be on guard. This comes in at a time when vaccine challenges remain high, even as the country expects few doses from today. Kisumu Governor Professor Anyang' Nyong'o says Kisumu will continue with plans to host Madaraka celebrations despite previous concerns. KTN's Health and Science reporter Sada Hassan has the details.
As of the 25th of May 2021, 3 SARS-CoV-2 genetic variants have been detected in the country. They are described as variants of concern, VOC, given their potential to impact on control efforts of COVID-19 pandemic.
Viruses are known to mutate, and COVID-19 is no different. However, there are concerns that mutations discovered in the country are still mutating further and community transmission is rising.
The ongoing genomic surveillance has revealed early and established community transmission of both the UK and the Indian variant of concern in Kisumu, Mombasa, and Kilifi counties.
And there is one that is tested and aligned with both the UK and the Indian variant. It is this one that the CS stated that is undergoing further genomic sequencing.
The new variants, however, have not shown severe infection among those infected, and studies show that vaccines are still effective on the variants. Despite vaccine shortages, Kenya is expected to start off second vaccination process on 27th May, targeting health workers in the first round.
Last week we estimated close to 100,000 will be available. And then tomorrow, we are receiving 72,000 doses from South Sudan, not DRC.
As cases of COVID-19 continue to be witnessed in the country, Kisumu County has been thrust in the headlines with the detection of the variants in the new infections, which have reduced slightly. However, events attracting mass gathering are of concern. The county is expected to host the 59th Madaraka Day celebrations, with the Governor Anyang' Nyong'o insisting that COVID-19 protocols will be adhered to.
There will be no gathering at Kirembe grounds or Moi Stadium or the Mall and Field in Nyamasaria. We ask everybody to stay at home and watch the event on their television or listen to the radio. His Excellency the President and his guests will, however, proceed to the Jomo Kenyatta International Stadium.
Currently, 341 new infections have been recorded out of a sample size of 3,646. This is a positivity rate of 9.4%, which is an increase of 2%. Unfortunately, 11 people have succumbed to the virus, raising the death toll to 3,108. Patients admitted in hospitals are 1,067. Those in ICU are 104. While those under supplemental oxygen are 149. Sada Hassan, KTN News.
All right, so that story by my colleague Sada Hassan, a Science and Health reporter, brings in my colleague, and I'm joined by our Science and Health reporter, Beldin Waliaula, who's also working closely with Sada Hassan from the Health Desk. And Beldin, good morning.
Good morning, Brenda.
So we're talking about the second dose of the COVID-19 vaccine. Hundreds of thousands of Kenyans took the first dose. But right now, when we're talking about the second dose that's supposed to be administered today at the KNH, how many doses have been brought into the country, and are the doses enough for all Kenyans who took the first dose of the COVID-19 vaccine?
Brenda, so far we haven't received any other shipment of the vaccines in the country since we received the 1.2 million doses from COVAX facility, together with the 100,000 doses, which was a donation from India. So far in the country, we have around 960,000 people who have been vaccinated with the AstraZeneca vaccine. So from the 1.2 million doses that we had before, we have approximately less than 200,000 doses remaining out there in different depots in the country. country. So this is what we are starting with as a country to offer the second dose vaccination to those who receive the first dose. So you see, Brenda, less than 200,000 doses to start with for the second dose vaccination, yet now more than 960,000 Kenyans have received the vaccines. That means that we're going to have a very big shortage, because if everyone starts going for their second dose, that means the doses remaining won't be enough. The Ministry of Health said that we'll be receiving some 72,000 doses from South Sudan, which is also coming from the COVAX facility, because South Sudan returned some of their unused doses to the COVAX facility, which has been donated to Kenya. So that will be from Dr. Willis Kwale, who is the chairman of the vaccination task force, said yesterday that those doses will be coming today, will be getting in the country today. So we are hoping that the 70,000 doses, together with what has remained in the country, will help in boosting the second dose vaccination. But so before also, Brenda, the chairman of the task force, also Dr. Kwale, had said before that we'll be receiving around 130,000 doses from DRC Congo. But he rectified yesterday that the doses will not be coming from Congo, but South Sudan.
In fact, I was about to pick your mind on the South Sudan issue. Does it mean that it doesn't have a lot of COVID-19 cases that have been recorded, or does it mean they have an issue with the storage facility? Why are they giving COVAX? You know, why are we now looking to South Sudan, who've decided to give back their doses, I mean the COVID-19 vaccine?
Brenda, you see, Kenya, we usually complain a lot, but you see, we have made a step when it comes to storage facilities and our vaccination program because of the children immunization programs in the country, like polio, which has boosted our storage facilities. So countries like South Sudan, Congo, they're still struggling with storage facilities and also transportation of these vaccines. Remember, these countries are also struggling with war. So transporting a vaccine from one place to another is going to be difficult. So most of the doses have been returned to COVAX facility, and they've donated to countries which are in dire need of vaccines like Kenya.
All right. So let me ask you, Bildin, yesterday when you were attending that press conference that was being held at the Ministry of Health, the government said that they're now completely done with the vaccination of the first dose. So what does it mean for people, Kenyans, who've not yet taken the COVID-19 vaccine?
So for now, going forward, there will be no first dose vaccinations. So those who didn't receive their first, who haven't received yet their first dose, have to wait until Kenya gets another shipment of vaccines. Remember, Kenya was supposed to get at least 2.3 million doses of vaccines by end of this month from COVAX facility. That has not happened yet. So the country is hoping to get Johnson & Johnson vaccines. That will be around August. So the rest who haven't received their first dose will have to wait until another shipment arrives so that they get their first dose. But at the moment, what will be coming into the country will be given out as the second dose to those who received their first dose. Because remember, the first person to be vaccinated was in 5th March. So WHO recommends at least 8 to 12 weeks period before receiving your second dose. Right. And 12-week period is coming to an end this week, actually. So that means those who received their first dose are actually in dire need of the second dose, because if you receive your second dose, it's when you have at least 80% protection from COVID-19. So the first dose only won't give you full much protections as when you get the second dose.
All right. All right. And you know, yesterday, you rightly put it, that the government is saying that those who receive the first dose should wait for 12 weeks, which ends this week, and should not skip the queue. So when the government says that you should not skip the queue, what process is the government going to use when it comes to administering the second dose? How will I know that I should not skip the queue? Let me go. And who are the first people who will be given the second dose of the COVID-19 vaccine?
The government has been documenting everyone who has been receiving this vaccine. They have a change system online where if you get vaccinated, your details are recorded there. So those who are due for their second vaccination have been receiving text messages through the change system telling them, you know what, you are due for your second dose, please come to the facility. So the government is saying, kindly wait for your 12 weeks. Yes, WHO recommends after 8 weeks it's possible to get your second dose, but at least wait for 12 weeks. The government government, I think, is trying to buy time so that if everyone, those who are at their 12th week, start receiving their first dose, at least those who are remaining before they get to 12 weeks, there will be a shipment in the country to give them the doses. So I think the government is just trying to buy time to ensure that we have doses in the country before everyone rushes to the facilities to get their second doses.
And so we expect the second dose, the second phase, the second vaccination phase to begin today at the Kenyatta National Hospital. Bildin, probably you can tell us what time this will happen and who is that Kenyan who will be taking that second vaccination, dose of COVID-19 vaccine.
Brenda, for sure, I can't say for who exactly will be getting their second dose, because there are a few Kenyans who have gone to the facilities and started receiving their second dose. But we are hoping that we'll have health officials who are there during the first dose vaccination rollout to be there today to receive their second doses. So the public figures who receive their first dose, like Dr. Patrick Amoth, we are hoping that they should go back there and receive their second dose so that they can just show the public that, you know what, if you received your first dose during the first week of March, you are due for your second dose, and kindly go and take your second dose. So KNH is just the first place where the vaccines were rolled out, so the second dose will be rolled out there, but also in other public facilities where vaccination is taking place, the rollout will also be going on. So those who are on their 12th week and due, kindly you can go and take your second dose.
All right, Bildin Waleaula, always a pleasure talking to you. Bildin Waleaula, Science and Health reporter here at the Standard Group, just talking to us about that second vaccination phase that kicks off today at the Kenyatta National Hospital. Definitely we'll give you that live coverage once it begins. So you have to wait for a text message from the Ministry of Health, so that you can go for the second dose. Bildin Waleaula, once again, asante sana. I need to release you so that you collect for us more data, in terms of numbers and more information from the Ministry of Health during that second vaccination phase. Now, and the Central Organization of Trade Unions, that is COTU, just 2 days ago threatened to pull out of NHIF if the government moves ahead